Hi guys, this is Dr. Brent Cornelius, and I want to talk to you today about a topic that we're getting a lot of questions on, which is my bite feels off. And so there's four that I'd really like to discuss today. The first one being clenching and grinding. And I know, before you tell me that you don't clench and grind, I'll tell you that most people who clench and grind don't know that they do. And so I'm a clencher grinder myself. I didn't think that I did until I saw the evidence of it. So it's a very common issue. I'd say at least half our population is a clencher and grinder. Some people clench and grind every night. Some, it's only episodic. It's whenever you're under a lot of stress. But you can imagine the side that you sleep on, you typically grind on. And so as you're wearing those teeth down, microscopically, you're losing tooth structure. And so over time, you'll get to the point where your teeth just don't fit together quite right. A second issue is a jaw joint issue. And I'm going to show you some models here in a second that explains that a little bit better. But there's a disc between the upper jaw and the lower jaw. And when that disc gets out of place, or if it gets damaged, your teeth just don't come together quite right. And so there's some things we can do to get the disc back in the right place. A third issue is an abscess. And so if you've got a tooth where the nerve is dying, it's becoming infected. That infection has no place to go inside of that tooth other than out the opening at the tip of the root. As it expels through the tip of the root, it creates a hydraulic pressure that pushes that tooth up out of the socket. Now you're only hitting on that one tooth. It can be very, very painful. And so if you've got an abscess down there, that can certainly cause a bite issue. And the fourth issue is something we didn't deal with 5 years ago, a relatively new development, is the self-directed orthodontics, so like Smile Direct Club. You really need to be under the supervision of a dentist when you're doing that, because there's some issues that can happen with your bite that are very difficult to fix. And so I've got patients who are Smile Direct Club clients, and they were either ashamed to tell me because they know we do Invisalign, they thought they were stepping on toes, or they were embarrassed that they didn't have me do it. I don't mind that at all. I want to know that. If you're using a product like that, we really need to be monitoring your bite to make sure that there's no issues along the way. So please, do let your dentist know. And that's a couple of the more common issues. I've got some models I want to show you that will help explain the jaw joint issues. But if you're having that issue, you really need to get into the dentist, let them take a look, because there's a really wide range of things it could be. So here's our first model. You've got an upper jaw with upper teeth, a lower jaw with lower teeth. You've got the joint itself and the disc. What you typically see with this is as this begins to open, you'll hinge only. That lower jaw hinges, that disc stays in place. As you open wider, this lower jaw begins to slide along the upper jaw, and as it does, that disc follows along. One of the issues I see most often is this disc is out of place, typically forward. As you come together now, you have bone on bone. This lower jaw is seated farther up than it should be before, and it throws the bite off here. If that's the issue, what we'll do is get a splint that fits between these teeth, and what that does is it opens up this jaw joint just enough to recapture that disc. Once that disc goes back to place, now your teeth are gonna fit back together again. The issue is getting the disc in the right spot. Very common issue. So here's an anatomic model that shows the same thing we were just looking at in the flat model. Upper jaw, upper teeth, lower teeth, disc, and the jaw joint itself. This disc does not move on this model, but if it did, what you would see is if this disc were displaced this way, this joint would come up too far where you had bone-on-bone contact between these, and as it does that, it opens up your bite. That's just an anatomic look at the same thing we were looking at on the flat model, just to give you a little bit of a better representation.